Welcome to HPP690E. This is Aging in the U.S. Public Healthcare Programs. This is your Week 2 video. Medicaid is the focus of Week 2, but we also want to think about how Medicaid overlaps, intersects with both Medicare and sometimes with Social Security. Medicaid is a state-based health insurance program that's mainly used for children, low-income adults, often pregnant women, elderly adults, people with disabilities. Unlike Medicare, it is paid for by the states and the federal government and is a state-based program. Just like Medicare that we discussed previously, Medicaid was born out of that Social Security amendments in 1965. Medicaid, when it first started, was envisioned to be a very small program, but as we'll see this week, it is actually a really big program now. Medicaid has made quite a few changes, as you know, from 1965. Some of the biggest ones were additional payments to hospitals that took care of a really large part of the Medicaid population. Those hospitals were making less money, and rather than have them go out of business, Medicaid basically paid them more money. Medicaid increased into HCBS and waiver programs. So these were programs that allowed people to stay in the community rather than receive those services in a facility somewhere. We'll talk a little bit more about that. We talk about that in depth in the long-term care course, if you also like to take that course. And then a big expansion was the state children's health insurance program, so bigger incentives for states to pick up health insurance for children. There were a lot of recent changes in the last decade. For those of you that have learned about or were witness to the changes in Obamacare or the Affordable Care Act, the point was to expand that Medicaid eligibility to pretty much everyone under 65 with incomes below 133% of the federal poverty level. So, whereas Medicaid only, states would only offer Medicaid to certain groups of people, the Affordable Care Act basically wanted that whole program expanded, and eligibility would be based on the federal poverty limit. And you wouldn't have to be like a disabled person or a pregnant person to necessarily qualify for Medicaid. It really standardized the rules across the states for eligibility. The problem was there was a Supreme Court case following the Affordable Care Act, and the Supreme Court said, states do not have to adopt the Obamacare Medicaid expansion. So states, rather than all having to do this change, were allowed to choose whether they did the change. At this point, there's about 39 states that have adopted the expansion, but not all have. So while Obamacare sought to really create standardization across the states, that didn't end up happening. The other thing is that the Affordable Care Act is back in court right now, and we probably will talk about that later on in the semester. If you're interested in that, there's quite a few news stories right now out about being back in court. Also important was how that would work with the exchanges. So once people were outside the federal poverty limit, they could buy a plan through those market exchanges. So there was a lot of changes in the last 10 years to Medicaid. I wanted to review one more time Medicare and Medicaid. Remember, they're two separate programs. For those people working in the public health community and the aging community, really important to know the difference, and that will come up later on next week. They are the basics are they're operated and funded by different parts of the government and serve different people. Medicare you can think of as the federal program that provides coverage to 65 and older or people that have a disability. Medicaid is a state program funded by the federal government that provides health coverage if you have low income. Now, of course, there's a bunch of nuances to that, but that's a good way to think of the difference between Medicare and Medicaid. Now, some people have both Medicare and Medicaid, and we call them dual eligibles. It means they are dually eligible for both programs. I just want to give you a little bit about the costs. Medicare spending in 2017 was $706 billion. And that was about 20% of total healthcare costs in this country. So 1/5 of total spending was done by Medicare. Medicaid is very similar to that. It was about $580 billion in 2017, and it's about 17% of total healthcare costs. So it's very close to about 1/5. Combined, the costs are over $1 trillion, and it's about 1/3 of all healthcare spending in the U.S. So if you think about all healthcare in the U.S., 1/3 of it is paid for by Medicare or Medicaid dollars. It's a lot of money. It increases every year, and estimates are that it'll be it's $6 trillion in 2027. So we can see the rise of healthcare costs and how much these programs cost in just 10 years. Some of the specific costs in Medicaid are about 3/4 of all Medicaid spending is for hospital care, physician services, prescription drugs. So 30% of that Medicaid money is spent on hospital and doctors and drugs. About 1/4 of it pays for other long-term care services and supports. So that would be those waiver programs, HCBS, nursing homes. 1/4 of all that money pays for long-term care. In terms of nursing homes, Medicaid covers about 60% of all nursing home residents in the country. So more than half of all nursing home residents are paid for by Medicaid. Again, specific rules for specific states. Even if states picked up the expansion, there is quite a bit of flexibility in the rules still for Medicaid. So Maine, Massachusetts, Vermont, New Hampshire, Connecticut, Rhode Island, all New England states might all have very different Medicaid rules. States are also allowed to experiment with rules if they get permission from the federal government. Requirements that people work if they're on Medicaid is an experiment that multiple states have tried to do in the last couple of years. That's not a requirement for all states. States ask the federal government for permission, and sometimes they're granted permission, and they can do that. So what does Medicaid actually pay for? It's really the same as your other insurances. It acts like an insurance program. The major difference is if you work and you have an employer insurance plan, it probably doesn't pay for long-term care. Medicaid, remember 25% of Medicaid costs goes to that long-term care. Private insurances don't usually pay for that. Medicaid does. Nursing home care, or if you're at home having a nurse come in and take care of you. That's usually paid for by Medicare, not usually paid for by a private insurance plan. Don't forget the exploratory readings. There's some really good exploratory readings that help you contextualize Medicaid and long-term care. That's it for week 2. As always, I'm here for your questions, comments, or concerns. I hope you're enjoying the course, and I'll see you next week.